I'm going to move to Dr. Jacqui Williams, who's a senior midwifery education advisor at the Nursing and Midwifery Council, known to many people. She's very experienced midwifery academic and practicing midwife with over 30 years involvement in pre and post-reg midwifery programs. And she keeps very strong links with midwifery practice and is very passionate about the role of the midwife and women-centered care. She's also a senior fellow with the Higher Education Academy and has particular experience in quality assurance. And she's done a lot of work. And the thing that she's going to talk to us about today is the Future Midwife Standards, I should say, transforming midwifery care for everyone. And if you haven't heard about this document, I'm not sure where you've been, but it is available online and Jacqui will share that. So welcome, Jacqui, and the screen is now yours.
So thank you very much for inviting me. I'm delighted to be here. I'm taking a slightly different tack today because although I'm going to be talking about the Future Midwife project and the new proficiencies and standards for midwifery programs, I also want to sort of send a message around how these are going to make a difference, not just to the students on these programs, but indeed for women, their partners and families and newborn babies, as well as midwives who are already on our register. Next slide, please. So the challenge that we have, and it's important that we remember that these standards are for what we expect newly qualified midwives to be able to know and do at the point of registration. So if you like, these are our sort of overarching standards that we expect. And importantly, number one here is that a midwife can meet the needs, views and preferences of women, newborn infants and families, that they're safe, they are effective, they're respectful and they're kind and they're compassionate. Next slide, please. We were very conscious as we were doing this work, and we still remain very mindful of this as the landscape of midwifery continues to be challenged, that there is so much happening within maternity services which will affect not just how the midwife will practice, but also women and babies and their families. And I think it's fair to say there's been some really exciting things that have happened for midwifery over the past few years. And some of these icons demonstrate that, such as the Lancet series and internationally the Sustainable Development Goals. But we also recognise there is some real challenges, such as the report of the Morecambe Bay investigation and indeed the more recent early report from the Ockenden review. And I think it was important that we were actually cognizant of all of that, and we kept that very much in our forefront of our minds when we were actually doing the work in this space to develop new standards and proficiencies. Next slide, please. And internationally, this document came out sort of latterly in the work, and this is a really interesting piece of work because obviously around the world midwifery is viewed perhaps quite differently than it is within the UK, and we're very fortunate in terms of the role that we have. But there is increasing recognition about the importance of the midwifery role for women and babies, and this important document about strengthening the quality of midwifery education is actually talking about this. So this is really very encouraging, and you know, one would hope that perhaps in the future that in many countries where the midwife is not practicing in the way that we're very familiar, that may be enhanced in the future. Next slide, please. So we had to obviously look at all the evidence. There was new and emerging evidence that came on board as we progressed with the work. We had to think of changing demographics and population health. We were very mindful of key reports and surveys, as well as the national policy for the 4 countries, being a 4-country regulator. And although those 4 national policies for maternity care are presented in a slightly different way, we were delighted to see that there is similarity across the board, particularly in terms of continuity of care. Next slide, please. We were delighted also when our council approved that these new standards would be based on this framework that had been published in the Lancet series, which our lead advisor, Professor Mary Renfrew, had of course been influential in this and led on this work. So to have this underpinning our standards was really important. And forgive me for those who are very familiar with this, but I will just briefly outline what this means, because for the eagle-eyed of you, you will not see that the word risk is not used within these new standards, and that was done on purpose. And the reason for that is what this framework talks about is that all childbearing women and infants need the care of a midwife. Now, for some women, as a result of something that develops during the maternity journey, or something that they already perhaps have before they become pregnant, such as maybe a physical condition, say as diabetes, or maybe something like mental health or a social situation. For some women, they will then need that additional care. And what this is saying is the midwife has a key role here to continue to lead and coordinate the care for those women who have additional needs and complications, alongside the multidisciplinary, multi-agency team, to ensure that all that care is coordinated and received. But importantly, those women, because of perhaps their complexities, still do not miss out on those essential midwifery skills. And I usually use a very tangible example of, say, a woman who has had to have maybe an emergency cesarean section and possibly then has missed out on early skin to skin and early breastfeeding, if that's what her choice is, because of the complication. What this is actually saying is that although there may be complications, we should still promote and offer the midwifery care. Next slide, please. So we now have two documents as opposed to the 2009 standards, which were one. So one is the standards of proficiency for midwives, and one is the Part 3 standards for pre-registration midwifery programs. And importantly, because of the way that they have been developed and the way they are phrased, it's very much encouraging educators to provide innovative opportunities on their programme, as well as providing best and safest care for all women and newborn infants. Next slide, please. It's also important just to show you how these fit into a suite of documents. So we have one framework for nursing and midwifery education for the universities to follow if they deliver our programmes. The Part 2, which is the standards for supervision and assessment, which I'm sure you're becoming more familiar with, because midwifery programmes now have all adopted those as a result of the emergency standards, rather than wait for their new programmes. And now, of course, we've got programmes being developed. Some are already approved and being delivered from last September. The majority then will become going through their approval event to start new programmes in September, and then the rest will complete next year, so that all programmes will have adopted these new standards by September 2022. Next slide, please. So I wanted to talk to you really about how this means that, why do we use this word transformation? Because was what I was asked to talk about. And the reason we believe this is going to potentially transform care is because these standards absolutely focus on the needs, views, preferences, and decisions of women and the needs of newborn infant. And I purposely emphasize the word decision, because sometimes women come and talk to midwives about the choices they're making. And perhaps the midwife would be saying, well, perhaps that wasn't a choice that was maybe made on evidence, and perhaps something that we wouldn't recommend. but I think these standards absolutely recognise that it is the woman's choice to make the decision that's right for her, and we need to support her with that choice, albeit that we need her to give her her and her family the evidence and the supportive information to obviously inform that view. Next slide, please. The other thing which is also important is that we've widened our definition of safety. And so we now view safety not just in the physical sense, but also in the psychological, the social, the cultural, and the spiritual. And when I was talking about women that would need additional care, this is the sort of areas that I was thinking about, that in terms of this safety in all those aspects. Next slide, please. And it's also important that midwives understand the impact of pregnancy, labour and birth, postpartum and infant feeding, as well as the early weeks of life, on the longer term health and well-being of women and babies, and indeed families. Next slide, please. There are 17 interrelated themes within these new standards. And I think what's important, I haven't written them all out here, I've just given you a little bit of a flavour, but when programmes are being delivered and students will ultimately be supervised and assessed, these themes are like a golden thread which go throughout all of the standards and the proficiency. So there is much greater evidence, for example, on enabling and advocating human rights for women and infants. I've already talked about the importance of using best evidence and how midwives find that evidence, as well as critiquing it. The importance that the midwife will continue with their ongoing learning and professional development, as well as enabling and advocating these needs, views, preferences and decisions. And you will also see that because continuity of care and carer is so important and it's the national agendas, we have a whole domain on that, recognising how important that is. Next slide, please. Within the proficiency, there are 6 domains. And I think it's important that none of these are more important. They're all interrelated. And I will just give you some highlights here. But domain 1 is around being an accountable, autonomous professional midwife. Some very similar proficiencies to our nursing colleagues, but some very specific ones for midwifery. Domain 2, as I've already said, is all around promoting and providing continuity of care and carer. So at the point of registration, the midwife will be able to work within these teams. This isn't something that they will need to learn when they're already on our register. Domain 3 and 4 picks up the Lancet series around universal care and additional care. And domain 5 is a new domain in respect of the midwife looking forward throughout her career as a colleague, scholar and leader. And then in domain 6, all the skills are all grouped together, the midwife as a skilled practitioner. Next slide, please. And this slide won't work in this space, but if you go onto the online space, you'll be able to use this as an interactive slide, which actually shows you where all these skills are grouped. Next slide, please. So what are the changes? Why are they transformative? Well, we've got 6 interconnected domains, the 17 themes. We now base it on the Lancet framework, which is an evidence-based framework. The role of the midwife is clearly articulated in the front of these proficiencies, as well as the importance of ensuring the views, professions and any preferences and any decisions that women and their partners and families make are reflected in the care. Human rights, continuity care, interdisciplinary working is also strengthened, and the full systematic examination of the newborn. So at the point of registration, again, the midwife will be able to undertake this examination within normally 72 hours of the baby's birth. And of course, that was very important to support the work of continuity of care. And because unfortunately, a lot of referrals to us are around medicines, we have also enhanced the knowledge and understanding of medicines management and administration in the undergraduate programme. Next slide, please. So, of course, it means that there are key considerations that midwifery programmes need to think about. And I think I want to stress at this point the importance of this partnership working with practice partners. 50% of the programme remains in practice, and these decisions of how these things will be undertaken are very important. They're all around the table. The EU directive still stands because they're embedded within our standards, but we are doing some important pieces of work, and I'm sure many of you on the conference today will input into this, because any changes we make will need to have consultation. I'm delighted to say that Midwifery moved very quickly to a midwifery practice assessment document. There's one for all England and Northern Ireland called the MORA, the Midwifery Ongoing Record of Achievement, and Wales and Scotland will have their own. But I think this is going to make a big difference for practice, rather than having to negotiate different practice assessment documents if you're working with different universities. Different routes and exit awards are also being looked at, which is very exciting because that widens access as well as giving different opportunities. And it's going to be very important that universities consider what will happen to students on current programmes. Next slide, please. And what does it mean to you? Well, of course, you are pivotal in supporting student midwives. And of course, student midwives on current programmes really need to know that they will absolutely be prepared appropriately to go on our register, because many, many programmes far exceed our standards. It's our standards that have been woefully out of date. We now, for the first time, have the role and scope of practice in the proficiencies of the midwife. And of course, now student midwives can be supervised by other healthcare professionals, as well as these new skills. And of course, what's important for yourselves, and many heads of midwifery now have been doing gap analysis to really determine where their workforce needs to be, perhaps have opportunities to develop further skills to support new students on the programmes. And it's an opportunity to have discussions during appraisals and as part of your revalidation to see that you are ready and prepared for these new students on these new programmes. Next slide, please. So I want to again thank you. All the documents, of course, are on the website, so I do urge you. We continue to work with universities in their stakeholder events, talking to women and families as well as practice partners to make sure that we adopt these new standards and everybody really understands what it means for midwifery going forward. So thank you very much, and very happy to take any questions.
Thank you very much, Jacqui. I mean, I was just wondering from a personal point of view, and there's always a little bit of a lag for the questions coming through. I would suspect that COVID-19 has slowed some of this down.
Yes, I mean, it's interesting. It did in the first wave, because I think our institutions had to work really quickly to adapt their programmes, take on board whether the emergency standards, put things online. So I think absolutely interesting. Some were so far on that journey, they continued and they went through their approval and were able to start their new programs. I've noticed that that work now has picked up. And although obviously we're in a this worse situation now, somehow people are really digging deep and carrying on, which is absolutely, fantastic. And, or even practice partners are attending meetings to support that new curriculum, and that's got to be praised, because that's really great. Yeah. So I think the momentum is increasing, and of course it has meant people working extremely hard. But I think because these new standards are so important, and when you look at things like the Ockenden early report, our standards absolutely are promoting all of that's being said there. So this is why it's not just about programs adopting the new standards, but it's absolutely midwives saying, well, what does it mean for me? Where do I need perhaps more professional development for my own practice, as well as supporting students, so that we're really working collaboratively, in these agendas. So they're not standards that are sort of sitting on a shelf collecting dust.
No, I think they're on my shelf. There we are. On my shelf. I think what is very positive, actually, and what it feels, certainly reading the document and having contributed, and the wonderful Lancet series, it kind of makes me feel that pre-registration programs is working very closely with qualified staff in their continuing professional development, and that's very encouraging, because that way, and I think midwives have got a huge long history of CPD anyway. We're the best at it because we've had the longest experience. And actually, it's going off on a bit of a tangent. Of course, our CPD for our reviewings came in many years ago, before anyone ever thought about it. And it's interesting, it came in to reduce the geographic kind of isolation, which is kind of happening at the moment because of different causes, with COVID, of course. So it's we're moving on really to the next session, but I know there's positive comments, not many questions at the moment, but anyone who's listening, remember that the NMC Meet the Expert is this afternoon at 3:45. I'm not sure, Jacqui, are you going to be at that one, available to answer questions?
I am, and we also have the stand, so do people
of course,
please do email us through that stand, because then if you've got more of a personal question, we're more than happy to take them, and anything that we don't get through today we can pick up later. So do go and see the stand, as well as Verena, my colleague, the other senior midwifery advisor, is there. So and yes, we'll be both on the panel this afternoon.
Fabulous, that's wonderful. That's a really good, and remember that the stand and everything is still available. You can put your questions in, and it will last for a little bit. I do have one question.
And so briefly, can I just say, that those thanks are very genuine. The NMC absolutely recognises how people are working, and that is really appreciated. Of course, for midwifery, it's business as usual in a sense, isn't it? Alongside all those other challenges that staff are, and we are listening and continuing to see what we can do in this space, and working with sort of colleagues like the Chief Midwifery Officer, Health Education, to make sure we're all joined up in our thinking. So, but a big thank you from the NMC. It is appreciated.
Fantastic. Thank you as well. That's grand. I do have one question.
Oh, right.
From Siobhan Callaghan. Hi, Siobhan. She wants to know, if HONS was to be introduced before the end of the course of training you're engaged in, would students be able to opt in? I think that's quite a tricky one, Siobhan. I think you might have to go to your university for that question, because it sounds a bit specific. Obviously Siobhan must be on a course that's a BSc and they're developing an ONS. My understanding is that's often linked to dissertations and things.
Yes, our minimum is that it needs to be a bachelor's degree, and the reason I don't want to go, it might get a bit complicated if I go in all the details, but it's because Scotland has a different education system, so we can't stipulate the honours part of it at the moment. I think so. AI obviously make their decisions, and many do obviously have honours degrees. So the question that Siobhan was specifically asking was,
if it was going to be introduced before the end of the course of training you're actually on, would students be able to be opting in? I know, because I'm aware as a teacher, sometimes you have to right at the beginning say what you're going to do.
Exactly. Siobhan, do talk to your midwifery lecturers and your LME about this. Often the universities have their own specific regulations as to whether people can move between different awards, but that will vary depending on the individual. So I suppose it's not saying that that's not possible, but it very much depends on local arrangements. Often if students can't, I think the other thing which is important to say, we are in this sort of transition, aren't we? So we've got students already on the programmes who perhaps have not been, for example, doing the systematic examination of the newborn. So they're still going to need that post-registrations opportunity. And in a way, this question sort of fits there, that if things can't transition, it's what is also opportunity in the post-registration space, because there are these requirements that if there are changes to programme, all the cohorts agrees and the university has to go through a process. So I suppose check locally, but do think about your professional development going forward, because that could be critical.
And what a beautiful way of completing, Jacqui. Thank you so much. So Siobhan, that was a good question.
Yes.
You set us on, but do go and as Jacqui suggests, go and talk to your university, your lead midwife for education, and your personal tutor maybe,
Yes.
because they can have the specific information. But thank you so much, Jacqui,
Pleasure.
for your session. That was really good.